Good morning, everyone. Thank you very much for having me. Thank you for the invitation, Tricia. We're going to move on from something that was very technically sophisticated to give an overview of an example of how data linkage worked in a small project that we conducted. And it was trying to understand the impact or the justification or an approach to ending chronic homelessness with supportive housing. And it's a data linkage approach that had never happened before in Australia, but we're really trying to model what colleagues had done and take it further from what had happened in the United States. This project really only happened because of so many people who had profound skills and generous effort, including Trish and Kath Taylor and many data custodians across the Queensland Government and Treasury, enabled us to access the data, so I thank them very much. Also grateful to the Department of Housing and Public Works who funded this research project. Really what I'm going to try and demonstrate today is the analytical and social power of linked administrative data. And this is quite obvious, but linked administrative data enables us to generate evidence and have an understanding about ending homelessness that we'd never had before in Australia. But in addition to the obvious quantifiable and measurable, and indeed the cost offsets that we demonstrate through this data, we really are able to demonstrate some socially significant things about the way people live, the identities that we ascribe people, and indeed this linked administrative data is a source of evidence that helps us think about people differently. I'm going to try and argue that later on. Also, linked administrative data, and one of the reasons we had so much support, particularly from Treasury, to do this project was because there was so much interest at the Queensland Government level about linking data to transform social policy. And that's what we've tried to do with this study, but because we're linking data across government departments, it really raises the challenging question about whose responsibility is it to implement and change public policy when the data is not sitting neatly within a government department or the responsibility of the Minister or a Director General. Just a very quick background. In 2008, many people may recall that Prime Minister Kevin Rudd came in and he raised homelessness as an issue of social significance in Australia. He kind of really evoked this idea of an Australian identity, and he said that homelessness was inconsistent with the land of a fair go and the way that we ought to treat people in Australia. And essentially he came in into the Prime Ministership and identified homelessness and ending homelessness as one of his key priorities at the time, in addition to the apology. And he changed the discourse and the whole national policy on homelessness, whereby he argued that we should be achieving measurable reductions in homelessness, whereby previously homelessness was thought about as a crisis and responses generally focused on providing crisis and temporary accommodation to people. Kevin Rudd saw it as a long-term and enduring problem, and we needed to reduce it, and we needed to reduce it in a way that we could count and measure. And also novel, although you'd be very surprised to hear that this is novel, he very much couched homelessness in the context of an absence of affordable housing. So central to the new policy agenda was building new housing, which was required to solve the problem of homelessness. And the presentations today is about one of those models of housing that were constructed around this time, 2008. There's also a focus on, we shouldn't just be focusing on the homeless population, but rather we should be focusing on those who are deemed the hardest to house. And these people are sometimes referred to as the chronic homeless or the rough sleepers. And these are people who have experienced homelessness for many, many years and often experience a range of health and social problems in addition to their homelessness. And the argument is that the former crisis system would essentially cream clients, whereby those who are hardest to house wouldn't actually be able to access the homeless accommodation. So there was a deliberate focus on providing housing, ensuring that people kept that housing among the people who were deemed hardest to house. And often this was couched in terms of it's cost effective to end homelessness in Australia. And this is drawing on the evidence from the United States, although we didn't have any in Australia at the time, but certainly many policymakers and advocates around Australia really jumped onto this idea that ending homelessness is cost effective. One of the models that was brought out around ending homelessness for those people who are chronically homeless is permanent supportive housing. Here's a version of, or the example of Brisbane Common Ground, which is in South Brisbane on Hope Street, right next to Goma. There are about 9 or 11 of these actually now across Australia, in every capital city with the exception of Perth and Darwin. Brisbane Common Ground is an example of permanent supportive housing. There are 146 independent units in this block, and there are support services located on site. So there are clinical nurses, there are social workers, there's concierge, and there are also drug and alcohol and psychological counsellors who come on site to the building and provide that integrated health and social care to tenants. Importantly, Brisbane Common Ground and supportive housing isn't homeless accommodation, but rather it's permanent housing. And the research that I'm drawing on today, or a small part of it, was tasked with asking the question, does supportive housing work? Supportive housing is affordable housing, and importantly it's long-term housing, so it's not a transitional program, it's actually housing that is meant to be long-term, and this means that people who live in the housing have a lease, so they're not clients of a program, but rather they're tenants of housing regulated under the Residential Tenancy Act. Also key to supportive housing, as I mentioned before, is the integration of health and social services. But social services and supports are voluntary and they're directed by the tenants. So people don't have to choose to engage with services. And importantly, if people refuse to engage, they can still continue with their tenancy. There's also no behavioural conditions. People don't need to comply with medication regimes or compliance with abstinence or sobriety. Even though many people who access this have psychiatric disabilities and active addictions, there are no conditions around those types of engagement or behavioural changes. Also, what's meant to be somewhat new in Australia is that people who are living on the streets get immediate access to this type of housing. It kind of transcends the idea that they need to move through preparatory programs and demonstrate behaviour change before they move in. In practice, people move from living on the streets in around Brisbane directly into Brisbane Common Ground. So we really wanted to see, does this work to end homelessness, consistent with what the policy said? And also, if it does work, we were tasked with asking, well, how much does it cost? Because many people advocated for this idea of permanent supportive housing and ending homelessness, not just because of moral or justice arguments, but because of cost effectiveness arguments. So we tested some of the theories about service usage and service costs. And the idea was that when people are living on the streets, they'll use lots and lots of government services. And there are two problems with this, the argument goes. One, the government services they use are inappropriate. They'll be using emergency departments when they don't need them. They'll be staying in inpatients longer than they need to because they don't have anywhere to go. They'll be coming into contact with the criminal justice system when they don't need to. Another part of the argument is that all of these services cost too much money to the state. And again, this is drawing on research from the United States. So we tried to test this idea. Do people who are homeless, living on the streets, use lots and lots of expensive and inappropriate services compared to when they're tenants of permanent supportive housing? So what we did, with the help of many, many people, including Trish and her team, was we got the consent of 41 tenants of Brisbane Common Ground. There were about 53 tenants at the time who were eligible to participate, and we got the informed consent of 41 of those tenants. And all of those tenants had been allocated a property in Brisbane Common Ground because they were chronically homeless. What we did, we asked them if we could access their service usage history for a 2-year period. So for 1 year, the immediate year before they moved into Brisbane Common Ground, when they were all living on the streets in Brisbane, and the second year when they were tenants of Brisbane Common Ground. So we wanted to be able to see the patterns of service change over time, a year when they were homeless compared to a year when they were tenants. They all moved in at different times, so our dates are all different for individual tenants, but nevertheless, what we did, we asked them, could we access your emergency department? There's a long list here: admitted patients, mental health, ambulance rides. So any time within the 2-year window, we found out whether they presented to the emergency department, whether they were admitted patient, if they were an admitted patient, what happened when they were an admitted patient, episodes of mental health intervention. We also found out how many times they offended, how many times they were a victim of a crime, how many nights they spent in the watch house. You can see the story goes on. How many times they presented to a court, how many nights they spent in prison, days on parole, probation, and how many nights they accessed homeless accommodation, including homelessness services such as brokerage and other forms of support that have a monetary value. I was a very, very young man when we started this, when I put my first ethics application in. The ethics application process was very, very, very long, and I'm a better person now because of what I went through. But nevertheless, as you can imagine, all of these authorities require ethics application, which of course is reasonable, in addition to the University of Queensland. So there was lots and lots and lots of work with ethics. Everyone did ethics for free, essentially, except for the Australian Institute of Health and Welfare, who charge you for ethics in addition to charging you for accessing their data. But other than that, all of the data we accessed and had linked, we accessed without cost. Administrative data is very, very objective, and it's robust, as many of you could imagine. And this is important because what people had tried to do previously was go and survey people who are homeless and ask them, how many times had you been to hospital last year? How many times did you been in an ambulance last year? And I don't know about you, but if someone asked me those kind of things, I would generally make them up because I would forget. If you're living on the streets with psychosis and an active addiction and spend your days in and out of hospitals and prisons, it's going to be really, really hard for you to recall. So we were able to access what is very, very rigorous and robust data. But because we could actually access not just whether someone was an inpatient or not, as important as that was, but actually what happened to them when they were an inpatient. Did they just have a plastered arm, or did they have a kidney transplant? Did they have it in Bundaberg, or did they have it in Brisbane? We actually know the cost difference for each of these kind of medical interventions. So we've got very, very precise data, costing data about our population, which is really, really important for this story that we're trying to build between what happens in their lives when they were homeless compared to when they're tenants of this brand new building that we can see here. I should mention too, this building was developed in 2008. It came about with Grocon, which is a massive construction company, agreeing to build this for cost. An architectural firm designed it at cost. They're fully furnished units. All of the furniture came from donations. So there was a real lot of community goodwill, in addition to the Commonwealth and state governments throwing lots of money in to building it. Some people may know this area. There used to be a Gambaro seafood shop on it. The Gambaro family provided this land to the state government at a really, really, I think it was $1 or something ridiculous. So there was loads and loads of goodwill about ending homelessness and not doing it with homeless accommodation and shelters and this kind of inadequate boarding house accommodation, but rather with permanent housing in a great location with access to support services. So there was lots and lots of goodwill and motivation among many sectors of Australian society to end homelessness. And people really wanted to know, does it work? And if it does, how much does it cost? Or importantly, and what we're going to argue, how much does it cost to keep someone homeless, sorry. So you can see our number of 41 is really, really small, but the story and the evidence that it provides is really quite compelling. On this column here, to the left, this is for the mental health data. We can see that there are 1,029 episodes among our sample of mental health episodes in the 12 months when they were homeless. Of those 41 people, there were 359 episodes of mental health intervention in the 12 months they were supportive housing tenants. So we can see the reduction there in the right-hand column. Of course, because health have such fine-grained, detailed information, we can even see the minutes of mental health intervention, and similarly, corresponding to the episodes, we see a massive reduction. We also know from ROGs and other sources, depending on the data we're talking about, how much these things cost. Our sample used $372,000 worth of mental health services when they were homeless, and they used $129,000 worth of mental health services when they were tenants. So we kind of go through, and we did this with Queensland Police Service records. Interestingly, they were the only ones who were not too interested in us getting ethics initially about accessing their data. We did in the end, but oh, yeah, you can take it, no worries. This is really, really interesting because the focus of this presentation is around costs, but I think there's some other really, really interesting messages, and we'll talk about those in a minute. But we can see that occurrences as offender went from 50 to 24. And this is really, really interesting because I've spoken to many, many police and many people in courts and who work in prisons, who work in hospitals. No one's interested in as the police refer to it, pinching a mug for urinating on the street. Police don't like arresting and charging someone for what is essentially a manifestation of their poverty. And we can see here that people are less likely to be offenders when they're in housing, 24 from 50. They're also less likely to be the victims of crime. They're also less likely, nights in police custody. This is a watch house. You know, the reductions go for an $81,000 reduction in Queensland Police Services. There's a massive caveat here. As opposed to Queensland Health that has very, very clear, or in most cases, very clear and precise costing information, QPS, we kind of just make up their costing data because they have none whatsoever. Well, we didn't make it up. We went to the criminology literature and they estimate the cost of being a criminal in terms of offending and being a victim of crime. And none of these costs take into account cost-benefit analysis. They're direct costs in terms of the police responding to them. Night in police custody, they have no data anywhere in Queensland which quantifies how much it costs to spend a night in custody. We got an estimate from the sergeant of the Brisbane Watch House which said it's about $800 a night to stay in there. And obviously these costs are primarily due to the supervision that people undergo when they're in the watch house. But the important point is, when they're living on the streets, they spend for 12 months, they spent 45 nights in the watch house, and that went down to 27 when they were supportive housing tenants. So we put all of these, our data sources together, and this is the column for 12 months when they were homeless, the 12 months when they were supportive housing tenants, and these are the differences. So we see admitted patients reduced by $591,000. That's phenomenal. Mental health we've discussed. Ambulance went up a little bit. This is interesting, and this went up principally because one of the tenants had, kidney dialysis, and they were transported to the hospital every day. So that went up. Corrective services, this was mainly because less people were in prison, went down $30,000. Courts, $10,000. Police, we've discussed. Specialist homelessness services, essentially, without any surprise whatsoever, if you have your own permanent housing, you're much less likely to go and present to a homeless shelter for a service. It went from $174,000 to $5,000. So what we see is, in the 12 months when our sample of people were homeless, they used $1.9 million worth of state government funded services, and when they were supportive housing tenants, they used about $852,000 worth. So there's a $1,124,000 reduction. This is the minimal, most conservative reduction because this is simply the services that the state government has recorded as providing to these individuals. So we do and this is what's really interesting because the analysis we're doing here is phenomenally simple, but the story it tells is really, really quite significant, we think. As we said before, it went from $1.9 million to $852,000 worth of services in the 12-month period housed compared to homeless. So if we divide the $1.9 million by our 41, we see that they used $48,217 worth of services per year on average each. Whereas if we divide our $852,000 by our 41, we can see they used $20,000 worth of Queensland government funded services. But we know that this wonderfully fancy and flash supportive housing building costs us about, when I say us, costs the Queensland government taxpayer about $14,329 to provide the housing with the on-site support. That's the clinical nurses, the social workers, the counsellors that come, in addition to the bricks and mortar, the tenancy. So we have to add the cost to the state government of $14,000 per person per year to the cost of services they use, and we can see that it's $35,000. It costs the state government in 1 year per person to keep someone in supportive housing, compared to the $48,000 it costs us when they're living on the streets. So it's a $13,100 cost offset of providing supportive housing to people who are chronically homeless, or we can say, somewhat more provocatively, we actually spend $13,100 per person more to keep someone living on the street than what we would spend if we had those people living in permanent supportive housing. And of course, I'm not an economist, and a lot of economists would like to stop there, but really when we think about it, the costs, if we're only interested in the costs, can be so much more significant to that if we think about the cost benefits to society, not to mention the cost benefits to the individuals when their lives change. But so because we did a whole heap of other methods in the study, including longitudinal outcomes among our tenants and ethnography, and we spent a lot of time in the building trying to see how they lived and whether it was home for them. What we did find is that the people who accessed this housing because of chronic homelessness, as I mentioned before, had a range, a myriad of social and health problems in addition to their homelessness. They were nearly all, they were all unemployed. Most of them reported addiction, mental illness, physical health problems, disabilities. None of them were engaged in training, caring for family, disengaged from children. And over a 12-month period, many of these things didn't actually change. Those kind of measurable outcomes about their lives that we're interested in didn't change in any significant way over the 12-month period. However, how people lived their lives changed in significant ways. And we know that from theory that social action is socially mediated. What we do is a product of the social context in which we live. And we can easily think about people who are homeless as being reliant on these government services and being reliant on welfare or reliant on health services. But what we can see is, and we have the very robust and rigorous administrative data to demonstrate this rather than just theoretical and normative arguments that we're making, but we can see with this hard administrative data that people's reliance on these kind of government services massively reduces when they're provided with the primary conditions to live, that is, housing. But really, really importantly too, when we think about people who are on the street, we often think about them in a way that their homelessness says something about who they are. We think about them through a prism of what they lack, and homelessness constitutes something about their identity, or the police might think about them as criminals, or the courts think about them as inmates, and prisons think about them as inmates, hospitals think about them as patients. All of these kind of identities that we impose upon them, all these kind of identities as lacking and as deficient and problematic, they're kind of remedied with the provision of housing, and we see them as tenants because their lives change in these measurable ways. And this is really, really significant. But there's some massive challenges for how this will, if at all, change public policy. And I'm really, really, really heartened that when I first presented this to the Department of Housing, the department that funded the research, they were really, really, really excited. And they were so excited that they got me to present to their minister, and then their minister got me to present to the DGs and DDGs and senior executive of Queensland Health, of other government, of corrections, Attorney Generals, of QPS, of Treasury. There's massive interest in this kind of data, but one of the problems is that this kind of evidence demonstrates that the Department of Housing and Public Works provides permanent supportive housing, but it represents cost offsets for other departments. We see that it has, for the bottom line of Queensland Health, for Attorney Generals, for QPS, for the organisations that provide homelessness services. So on the one hand, it's been my observation that universally, everyone in government has been significantly interested and excited and inspired by these results. But then on the other hand, it's very, very hard for this to translate into a change of government policy because it can only be thought about as a whole of government or a cross-government proposition. And this is where Treasury and Premiers are really, really important because they have the mandate and they're in the position to really care about how an intervention impacts other departments of the state. Whereas Queensland Health might not be as interested about the way supportive housing funded by housing has implications for Queensland Police, for example. So we really need that broader level of government authority that can think about the way social problems and solutions to social problems have an intergovernmental impact. And Treasury have been key to that, and that's really what we're trying to do now is to talk about this evidence and present this evidence to those people who have the responsibility and the mandate to address these problems at a whole of government level. The full paper is accessible if anyone would like it, and that's it. I think that's a good time.